It's my feel-good breakfast show.
It's a Tuesday morning. Welcome back to your Feel Good Breakfast Show. Time right now for our weekly health segment with Dr. Darren Green. And today we're focusing on one of the most common health complaints across the board. Joint pain. We've all had it at some point, isn't it? Yeah, we really have. From our elbows, our wrists, fingers, ankles, and toes that click in the night when you don't know what is the sound. Yeah, well, you don't need to start worrying too much about it, but you can give us a call on 021-430-9881 for our joint discussion.
Oh, I love joint discussions. But the thing is, like, I am actually concerned, and I want to know, when does one start worrying? Because before we get into anything else, I'm a joint cracker. I love cracking joints, especially my knuckles. Is it bad to crack your knuckles?
Well, interesting you say that, because they studied the X-ray findings in 400 people, and they actually discovered that in people that do crack their knuckles, some of their blood supply as well as their movements at the joint were actually better than people that don't crack. But the problem comes in, but there's a but, the ligaments on the side of the knuckles are what can become subluxed and loose and a little bit pop if you don't look after them properly.
Okay,
so,
but it's not like if you do that, something's going to go wrong.
No, there's no evidence at the moment.
Yeah, but what exactly are joints comprised of? Because, I mean, they're everywhere. They're here, they're in your hip flexors, they're there.
Everywhere.
What is in a joint?
So it's where bone meets bone.
Yeah.
So in order that, for us to move, we can't be a rigid pipe-like structure.
Yes.
So we need these joints to obviously allow the skeleton to do its magnificent things on a day-to-day basis. So if you think about it, you have ball and socket joints, you have hinge joints, etc. You've got all that. But at the surface itself of the joint, you have different things. Sometimes the connective tissue, which is the muscles and the soft tissue, they can actually stabilize a joint. Other times you have cartilage. Everyone's heard the word cartilage. Yes. And other times you have what's called synovium, which is a capsule filled with fluid that is made and manufactured by a special membrane that lines the joint. So we need all these different types of joints, according to their structure, to fuel and to facilitate movement at the different areas of the human body.
Exactly how many joints do we have in the human body, though?
About 340.
Wow.
340. That's a lot.
That's a lot of joints.
And how does one... Because, I mean, this was a very, very common one, especially among the sporting fraternity, when you've sprained an ankle versus tearing a ligament.
Yes.
What's the difference?
Yes.
One is more severe than the other.
Oh, we see someone being strapped over there. So we always, when we twist the ankle, for example, we regard it as a sprain injury or a strain injury. That's when a muscle is stretched past where it should be.
The actual muscle itself.
The actual muscle is stretched. A tendon itself can be, because it's where the muscle flows together into a more stiff-like cord, and that tendon then inserts into the bone.
Like Achilles.
There is a beautiful example of a tendon, and that then attaches to the bone with special cement glue that the body obviously has. Yeah. So what happens is, when you have obviously a tendon rupture or an avulsion, that tendon pulls off the bone. It pulls off due to obviously a very strong motion or force. Yeah. And the other thing is secondary to medication. Certain antibiotics predispose you to tendon rupture, which is also quite interesting.
Wow. And why does it take tendons so long, or ligaments so long to grow back, to reattach?
Well, the body, if you look at it, so if you immobilize it, in other words, you don't put weight on the leg, and you also obviously not making the injury worse, you then allow it to grow back. And the rate at which the new glue, so to say, is deposited and it attaches again with that scar tissue formation takes time, it takes weeks.
Yeah. This is a very, very interesting topic indeed.
I'm
hoping that you'll be engaging with us, giving us a call on 021-430-9881. We'll keep Dr. Darren Green in the hot seat for more joint conversations.
It's my feel-good breakfast show.
Well, we are continuing our chat on joint pain this morning with Dr. Darren Green. Now, if you have had those niggles and if you're a little concerned, when should you start worrying? That's what we're here for. So give us a call on 021-430-9881. Time for us to talk knee pain, though. A lot of people have experienced knee pain, and they also say that it is one of the most common complaints that people have.
Definitely, it's the site of pain. And I think a few reasons for that. It obviously carries the entire body weight.
Yes.
So you can imagine we do give the knees quite a big hammering. It's a large joint, carries a large weight. And obviously, with the action that it performs, if you think about climbing steps, going downhill and so forth, it's very dependent on the stability of the neighboring muscles and tendons to actually perform its function.
We've got a caller right now on the line. Carol, all the way from Cape Town. Good morning, Carol.
Morning.
Thank you so much for your call. What is your question or your comment?
My question is, I used to crack my knuckles, and now I can't, and my hands go very stiff. And I try and do a couple of exercises with them, but I have no idea what's going on. And then it goes into like a spasm, and it like all pulls in, and I'm not sure what the hell it is.
Thank you very much for sharing with us, Carol. Dr. Green.
So stiffness of the hand joints is something that needs to be examined, always needs to be looked at. You might need a visit to your practitioner and as well as an x-ray of the hands to look at what's actually happening on a micro level at the surfaces of the joints. You know, we can look at wear and tear. People speak about osteoarthritis and degeneration of the joints from wear and tear, the type of activity you do daily. But you also get other causes, inflammatory arthritis that can affect the joints, leading to a prominent feature of things like morning stiffness. That's a very important thing to obviously exclude. So I would suggest that she has that examined by a practitioner.
Yeah, all right, thank you very much, Carol, for that. And we'll get to talking about arthritis very shortly, but talk to us about the other common conditions that lead to this knee pain and other joint pains, the common conditions.
Yeah, so if the knee is sore, it doesn't mean the problem lies in the knee. There's often referred pain in the knee that you get from hip pain, for example. Referred pain from the hips, where the nerve supply basically radiates pain all the way down, and you actually think it's in the knee, but it's actually the source of the pain could be in the hip. So that's also quite important. Also to notice associations of the pain in the knees with movement, time of day, etc. Because from overexertion and things like tendonitis all the way through to osteoarthritis of the knee, and then, of course, things like gout. There's a wide array of things that can affect the knee in terms of local pathology, excluding, obviously, things like trauma. So people don't understand that twisting your knee or bending in an irregular position that you're not used to can also lead to strain on the knee itself. And obviously, you aren't as bulletproof as you think you are if you're not maintaining the knee and that function over time, and then suddenly you load the joint with a new activity or an increased load.
Okay, well, we're going to keep our lines open, Dr. Green, and next up we'll be focusing on gout and arthritis, as Dr. Green just said. So give us a call on 021-430-9881.
It's my feel-good breakfast show.
Welcome back to your Tuesday morning on your Feel Good Breakfast Show. Welcome back to The Joint. We're hanging out with Dr. Darren, and we're talking all about joint pain. Yes, this is The Joint, where we sit around, have serious medical discussions. And we're going to focus on arthritis and the like very shortly. But during the break, we had a conversation with one of our cameramen about gout. And how it's linked to joint pain, how it's the most excruciating pain ever.
It is quite, and it comes on so quickly, and the most common site is obviously in the big toe. You can see it becomes red, inflamed, and angry and hot to touch. But it comes on within hours. People that have gout know they've got gout because of the onset and so on. And it's caused by high uric acid levels. So you get then crystals that are deposited at that joint surface and irritate that tendon as well. And those crystals then lead to an inflammatory reaction with the redness, the swelling, and the heat, and so forth. And the way of dealing with that, obviously, is lowering the uric acid levels, but also treating with an anti-inflammatory.
Okay. Sure. We've got a call on the line right now. Mary, all the way from Brits. Good morning, Mary.
Good morning.
Thank you so much for your call. What's your question or comment?
My question is, I've been diagnosed with osteorheumatoid arthritis. I've got severe pains in my hip and my knee, and my hands sometimes they just like cramp and they go very, very stiff. So what is that?
So the definition that she used is osteorheumatoid arthritis. We usually teach people how to differentiate between osteoarthritis and rheumatoid arthritis. Very difficult because the age of onset is generally the same. It's after 35 going up, generally between 40 and 60. The big difference is that osteoarthritis involves obviously a smooth cartilage joint becoming rough over time, growing little spikes of bone that then irritate that joint. Rheumatoid arthritis is an autoimmune condition where the body actually attacks its own joints. So it's an autoimmune condition where you have antibodies going to the joint and affecting the synovium. So that's the fundamental difference. The dominant features of rheumatoid arthritis are obviously more stiffness, as I said in the morning, and obviously the deformity deformity is often quite disturbing, where the fingers, for example, deviate outwards, and you can have quite significant pain with it. So understanding the difference is quite important, because the treatments differ in terms of what we call DMARDs, or disease-modifying drugs, for rheumatoid arthritis. Osteoarthritis generally, in terms of approaching it, involves you maintaining function and use of the hand, exercising it a lot, and obviously treating the pain.
Yeah. Well, you know, this is one thing that I want to know, like, is this something that just kind of, you know, starts and continues over time? Is there something that brings it about? We can answer that in a little bit. But if you are suffering from arthritis or know anyone that is, please do give us a call. Dr. Darren Green is here to answer all of those questions and, of course, to lend some assistance to whatever you may be going through. That number is 021 4309 881.
It's my feel-good breakfast show.
Well, we're back with Dr. Darren Green with one more segment relating to joint pain. And I just wanted to ask you, with rheumatoid arthritis, or osteoarthritis, is it something that develops over time, and what brings it about? And is it just something that older people get, or can young people get it as well?
You do get arthritis that occurs in young people. You get juvenile arthritis that can last anything from 6 weeks in episodes to obviously a few years, and sometimes they grow out of it. But rheumatoid arthritis generally is there to stay. Yeah. So you need to take medication to modify its inflammatory response. As I said, the body attacks itself. Okay. Osteoarthritis is normally due to the aging process and wear and tear on the joints. Okay. And that obviously is going to occur later on in life.
Yeah. Right. We've got a caller on the line right now, Rodney from Cape Town. Good morning, Rodney.
Good morning, good morning. I'm a plumber, Dr. Green. Okay, right now, as soon as I work with the water, then I get my spanner in my hand. And it takes me about 4 or 5 seconds to release the spanner again. Now, what seems to be the problem there? It's starting, man.
Great, interesting question. Thank you so much for that, Rodney.
Thank you, Rodney.
So it sounds very task-specific. There are conditions that affect the muscles going into spasm where you can't release them afterwards. Don't want to scare anyone, but certainly it's something that will have to be looked at. One of them are task-specific dystonias, for example, where your muscle goes into spasm or cramp and doesn't release. In his case, it could be from holding a tight grip of anything for a long period of time, where the muscles then go into, you know, that's absolutely spasm position. And so one would want to differentiate whether the problem lies at the level of just being task specific, or the muscle itself not being able to relax. And that's what you need to differentiate with seeing someone.
I think this is something that we take for granted until the point when we realize, oh no, now it's a really big problem. What can we do to make sure that we maintain good joints? Because you want to try and avoid these things, right?
Yeah, so progressive loading of the joint, not overwhelming it suddenly with a new workload that you haven't prepared for. Squatting, lunging, playing squash, for example, when you've been a weekend warrior and don't train at all during the week, only train on weekends, you should guard against that. You should have a progressive conditioning approach to progressively adding weight and the type of strain to the different joints as well. Then, of course, lubrication is king. We need to lubricate the joints, and that means those synovial joints that make fluid from its membrane, those cells release fluid and keep the joint obviously lubricated and moist so that it can perform and move smoothly, almost like oil in a ball bearing, for example. That also needs to happen. So exercise, chronic movement is essential in good joint health. Even those that have joint disease need to move to maintain the function that they have left.
Yeah. Dr. Green, thank you very much once again for sharing your extraordinary knowledge with us. As always, it is a pleasure. And thank you so much to everyone who called in to share your questions and your comments. We look forward to our next joint conversation with you, where we join minds on a Medical Tuesday.